Welcome to Atlanta Community Profiles, a show about living in Atlanta. Atlanta Community Profiles is hosted by Lou Whelan, who will talk to experts who know this ever-changing city and its real estate industry. We'll talk to mayors, community leaders, and commercial and residential real estate experts. And now, here's Lou Whelan with this week's Atlanta Community Profiles.
Hello there and welcome to our show. My name is Lou Whelan. I publish the official relocation guides on Atlanta that are distributed by the First Multiple Listing Service of Atlanta. They are available in every real estate brokerage firm and Chamber of Commerce in the metro area at no charge. So stop in and pick up a free copy. We have 5 publications, one for the metro area, one for North Fulton that's published in partnership with the North Fulton Chamber of Commerce, one for Cobb County that's published in partnership with the Cobb Association of Realtors, one for Gwinnett County, partnering with the Gwinnett Chamber, and one for Inside 285. They're also available on my website, atlantacommunityprofiles.com. I'm also a realtor with Berkshire Hathaway Home Services, Georgia Properties, and my website is louwhelan.com. If I can help you with any commercial or residential real estate needs, I'd be more than happy to do that. Every week we interview community leaders, and today is we're very blessed to have a very interesting and brilliant person on the show, a person who I heard speak at the North Fulton Chamber of Commerce recently. Her name is Dr. Vonda J. Wright. Welcome to the show, Dr. Wright.
I'm thrilled to be here, and I want your audience to know that you're not actually my PR person, but if you were, you did a great job. You called me brilliant. It's all good.
Really?
Yeah, really good.
When everybody will find out that you're brilliant by the time we finish with this show, so might as well let them have some insight. I would like to clarify, I'm looking at your business card,
Yes.
and after your name, it's MD, which I understand.
Yes, physician, that's it.
MS, which is,
I have a master's degree.
Master's degree?
In oncology nursing, actually. So as you're reading off the rest of those alphabet, my first medical job was as a cancer nurse and in Chicago. So that's what that MS is about.
And then I have FAOA.
That's right. So within orthopedics, there's several societies of people get together for common interests, and the AOA is an honor society for leaders in orthopedics. Mm-hmm. And thankfully, I worked hard enough to get in that. So and was nominated by my bosses. So I'm really thrilled about that.
Well, congratulations on that. Dr. Wright is a board-certified orthopedic surgeon, author, speaker, sports medicine program chief, and she is the head of sports medicine at Northside Hospital.
Yes, I am actually.
Mm-hmm. And basically internationally recognized author. She's written 5 books on orthopedic medicine for different demographies, right?
You know, so I like to write because I feel like, did you know that the word doctor actually is derived from the word teacher? And so it's not surprising then that lots of doctors take on the teacher role with their patient. And so I learned long ago that if I want to really teach people, but I can only physically see maybe 100 people in a week between my clinics and surgery. If I really want to talk about things that are important to people's health, I have to communicate in a different way. And as a communications guy, I know you're going to understand that. So I started writing books. And because books then lead to this kind of interaction on the radio and the TV, and then 5.5 million people later, somebody's heard the message and maybe changed their health because of it. So those 5 books are actually tools for communication.
Would you mind just mentioning the titles of the books?
So in 2006, I wrote my first book called Fitness After 40. And the reason I did that is because in 2005, I was the research director for the Senior Olympics. So the Senior Olympics is a biannual Olympic Games for people 50 and over. The national games, you have to have won your state competitions to qualify. So these people are everyday citizens like you and me. They all have day jobs, but they have conscientiously invested in their health in the form of mobility, whatever their sport is, to the point where they're winning their state meets, track meets. There are 18 sports in the Senior Olympics, and then they all come together nationally. So I wanted to figure out how in the world they were doing it at extraordinary ages. You know, the oldest athlete that I've ever seen there is 103 years old. The youngest is 50, and I got to tell you, people in their 70s are thinking that 50 is too young because those guys, you know, they shouldn't be in the Senior Olympics. But 50 to 103. And so I did research. It was a start of a long series of research that I did looking at what we're capable of with aging and longevity if we take the variable of sedentary living out of the mix. Because I do not believe, as an orthopedic surgeon, for 1 minute, that we are destined to go from the vitality of youth down some predictable, slippery slope to the frailty of aging passively. I don't believe that that's the way we were made. I believe that the reasons many of us age like this, and you know, this curve has blips in it, like heart disease and dementia and diabetes, because in this country we live in a sedentary way, and we know that sedentary living has a devastating effect on health. It's now knowing that sitting in a chair 10 hours a day in an office is worse for you than smoking in terms of your overall health. So I started, this is a long answer to the book question, but I started looking at what if we take the variable of immobility out? What if we look at people who invest every single day in their mobility and look and see what they're capable of? And so the Senior Olympics is a great place to start, because before you, when the Senior Olympics were in Pittsburgh, where I just recently moved from, we had 11,000 athletes from 50 to 103 who are demonstrating what life can be when we invest in mobility every day. So off of that research, I did two things. I started my line of academic research, and we've published a lot of papers out of the institute that I founded, and I started writing for the public. And Fitness After 40 is the first of that. And then the other books just followed. So there's Fitness After 40, which talks about how to face your future. FACE is an acronym for everything we need to do mobility-wise as we age. After that came Guide to Thrive. Now, Guide to Thrive, and I know I'm in a radio interview, I'm supposed to say all available on Amazon if people are interested. So Guide to Thrive is actually a strategic plan for aging, because I realized that in my own life, and probably everybody's lives I knew, that we plan everything. We plan our jobs. We plan, if you're a corporate executive, you plan the next 6 months, 12 months, 18 months. You have a 5-year strategic plan. You know, we plan our kids' lives. We probably plan the lives of our neighbors' kids, and they don't even belong to us, right? But I never met anybody that had a strategic plan for their health. And so Guide to Thrive is all about that. It's 4 steps. And frankly, I borrowed the 4 steps from business, right? You create a vision based on who we know we are today. Visions for the future have to be based in reality today. You can't just say, for instance, my example is, I would like to be a rock star. Well, I actually would really like to be a rock star singing on stage. The reality is I have a voice that's made for choirs and the shower. So, and not the chutzpah to get out there and just belt it on stage. So to create a vision. Then you must take action. A vision without action is just words on a page. Then you must, to get to achieve, you have to remove the barriers that are stopping you. So most of the time they're mental. Sometimes physical. But so Guide to Thrive is a strategic plan. It's a 6-month strategic plan, so it's a step-by-step. The third book, Fitness After 40, 50, 60, and Beyond, I got a lot of feedback from the first book, even though Fitness After 40 was written for everybody, that, hey, what about me? I'm 62. So we completely revised it and wrote it by the decade. The fourth book, Younger in 8 Weeks, it was written with Rodale Press. And it's actually a conglomeration of 4 or 5 physicians, and I was just fortunate enough to be the lead physician. And we address every aspect of health in that book. It's really a cool book. And then finally, the textbook that just came out this year is called Master for Care of the Aging Athlete, because not only do the public need to know how to do it, but doctors do too.
So that's, and they're available all on Amazon?
Oh, yes, all on Amazon. So
buy them online.
Yeah, that's right.
So when we get back after the break, we're going to talk about different areas of medicine
Yes,
that apply to improving your health and fitness,
absolutely.
and preventative and curative.
Perfect.
Stay tuned. We'll be right back after
Good.
the break. Welcome back. We're talking with Dr. Vonda J. Wright, Chief of Northside Hospital Sports Medicine. And by the way, if you missed the first segment, it's on my website, atlantacommunityprofiles.com. And Northside, let me just read something that was written in a magazine recently, Forsyth County Magazine, about the program. Northside Hospital Sports Medicine's network team of clinical experts include orthopedic sports surgeons, non-operative sports medicine doctors and physician assistants, a full complement of surgical and medical consultants, a comprehensive sports concussion program, sports nutrition, physical therapy, and a sports performance and innovative search initiative in 10 locations across the metro Atlanta area and North Georgia. So it's a pretty good definition of the medical service provider with whom you work. So we appreciate your coming on, and we have a lot to talk about, and I don't really know where to begin, except there's so much to talk about. I guess we might start with, what are some of the most common issues that you face every day, or generally speaking?
What are the most common issues that the patients I take care of face every day, or
that come to Northside Hospital
for Northside?
in general?
Well, you know what? I've just moved here 5 months ago, so I should have talked to you before I did to get the lay of the land. But we ended up in a great house. So, but I've only been here 5 months. But as I was discovering, vetting this job, as they vet me, I was vetting them. I discovered the amazing things about Northside Hospital. That we are known for birthing 20,000 babies a year on our 3 campuses, which frankly is 10 times the size of the town I grew up in, Kansas. It's amazing. I mean, you're birthing towns here. And on the other side, for beating cancer, right? So that's what Northside's pillars are known for. And apparently over the last few years, Northside has then began acquiring some of the best physician practices in the whole region to come aboard as partners with them. And so a few years ago, they looked at what they were doing and said, you know what, how are we going to lead preventive health in this community? You know, we're taking great care of mamas and their babies. We're helping people beat cancer. We're filling in the middle with all the internal medicine and the cardiology we have. But how are we going to really pivot to preventive medicine? And so they made this really amazing decision to focus on orthopedics and sports medicine. Because if you ask an orthopedic surgeon, hey, why'd you go into orthopedics? In addition to talking about the mechanics of it, the carpentry of it, which we all love, they will say to you things like, I loved orthopedics and sports medicine because we treat people from birth to death. You know, we treat babies with bones and muscle problems and people who have broken their hip in old age. So it really enables us to take care of people across the lifespan, which is what Northside is all about. They've promised a lifetime of care. So when they brought sports medicine around, we decided to talk about what we do as a lifetime of health, because mobility and keeping people upright on our legs, which if you look at the people sitting around you, you'll see that the muscles below our belly buttons are the strongest in our whole body. So that means that we are designed to move. If we were designed to be sedentary, we would be shaped like mushrooms with flat bases. I mean, nature does that, right? It designs according to function. So we would be mushrooms, but we are designed to move. So we have all the strongest muscles below our bodies. So as a sports medicine doctor, I'm getting to your question. I believe that my job is to save your mobility and therefore save your life. Because if I can keep you mobile, You are not going to sit around in a chair and develop diabetes, gain 100 pounds, get hypertension, have a stroke. We know that mobile people can preserve their health and longevity longer. So it gives new meaning to a sports doc. You think, oh, you're a sports doc. All you take care of is people on the field, athletes. We do. Yes, we do, and we love that. But for citizens of Atlanta, we actually return your mobility and therefore save your life. And so how does that manifest on a day-to-day basis? So I was in clinic today before I came here seeing people. And so I saw someone who lifted something too heavy and ruptured a tendon in his elbow. Now, we could leave that, but he will lose 40% of his ability to turn his hand. So how does that manifest? So you can't change a tire without the ability to torque a tire iron. You can't open a jar. Anything that involves twisting your hand, he's going to have a 40% deficit in. That's an upper body extremity example, but he's not going to be able to work. So we return mobility to that arm through what we do, and this man can feed his family again. I had another person in the clinic today who I gave an injection into a knee. If I take pain away from a knee, whether by injection or surgery or reconstruction, that person will walk again. They will go to work. They will not sit in a chair and get injured or, get sick. And maybe they'll feed their families. So this whole mobility aspect of what orthopedics and sports medicine does really gives life to life, right? Mm-hmm. I keep you mobile. We save your lives. You get to do what you love.
What do you think about stem cell therapy? Is that real or is that a hoax?
Well, listen, remember that MS in my title, Masters of Science? So when I was a nurse in the 90s, I worked for a hematology department, so the blood department, right, the blood cancer department. And my research at that time, I was one of those guys sitting under a hood that you see in movies, pipetting cells into another, and we were pipetting stem cells. Even in the 90s, we were trying to figure out how to get these things to do what we want them to do, because the definition for your audience, the definition of a stem cell is pluripotent, which means it can do anything it wants to do with the right stimulus. So how do we harness the power of stem cells without hurting people, right? Because cancer is a stem cell gone bad, right? It's out of control stem cell. So we need to figure out how to harness this miraculous cell that we all have in our bodies without hurting people. And I started with that science in the 90s when it began, and we are still not there yet. So when you ask me that question, I come from a really experienced place, from a hematology lab and a blood cancer lab. Do I believe that our bodies are capable of healing themselves? Yes. Do I think that stem cells will play a role in that in the future? Yes. Do I believe for 1 minute that we have the lock on how to do it in a controlled way without hurting people? Not today. Probably not in my lifetime. Not in my work time. I'm going to work a number of years to go, probably not in my work time. We're getting there. The science has exploded, but as an academic, we have to be really, really careful because it's people's lives we're dealing with, right? So you're going to see in the community lots of people, and they may be calling into the show or calling into your website, advertising stem cells. And some of them are legit and some of them are not, but all of them are expensive. And so my word to people thinking about it is to be careful. Know what you're getting. Do not get your information off the internet. Go to someone who actually deals with medicine, not just someone who can hang a shingle. You get buyer beware. Do I think the time's coming? Yes. Is it now? No.
Now, a friend of mine went to a company that turned out to be disreputable, and
that's right.
Was very detrimental to his knee. He played football and got injuries. As he got older, he needed that because he had bone against
That's
bone.
right. He had arthritis. Sure.
And so be careful. I appreciate the words of the wise there, because there are people out there who cannot be trusted and who advertise things that they cannot deliver upon.
Or that they're not qualified to do. There's some really good people trying to figure it out, but there are some charlatans. So just buyer beware, like any product.
So when we get back, we're going to talk about concussions.
Oh, great.
And we're going to talk about preventative medicine for one of the fastest growing segments of the population, which is the active adult community.
Absolutely.
And after 50. over 50 or
Perfect.
even over 60. So stay tuned. We'll be right back. Welcome back. We're sitting here with Dr. Vonda Wright, who is the chief of Northside Hospital Sports Medicine. And Dr. Wright has a BS in biology from Wheaton College, a BS and an MS in oncology nursing from Rush Presbyterian St. Luke's Medical Center, a doctor of medicine from the University of Chicago Pritzker School of Medicine, residency orthopedic surgery, University of Pittsburgh Medical Center, and research fellowship, Stem Cell Research Center. And we talked about stem cell in the previous segment, so if you would missed it, please take a look at my website. You'll be able to hear that. But certainly appreciate your service to the citizens of our community. And one of the biggest things that we issues in sports is concussions, whether it's high school or professional sports. And how prevalent is it, and what are the long-term consequences?
You know, concussion is a really hot topic in this country and has been since I started practicing about 20 years ago. But in that 20 years, we've really begun to understand and still have so long to go to really understand what's going on between our ears, right? So historically, the brain has not been viewed as an organ like a knee or a shoulder. But in the last few years, the conversation has switched from, the brain is just this nebulous piece of soft tissue, to when you get a concussion, we're treating it like an injury. It's not a knee injury that you can see, but it is an injury in the brain. It's a chemical dysfunction. It's an energy crisis. So when the soft tissue of the brain hits against the hard skull, it causes a change in the metabolism of the brain instantaneously. And our concussion experts describe it as an energy crisis. It's hurt, it needs more energy, but the brain can't generate it, and so the brain becomes concussed. But, you know, I keep mentioning that I only moved here five months ago, but at the University of Pittsburgh, where I come from, it was on the forefront of concussion research for the last 20 years, and in fact, invented the impact test, which is the executive function test that defines a concussion. And so I was so fortunate when I came here to Northside Hospital that I was able to bring with me one of the faculty from the University of Pittsburgh, who is one of the highly trained neuropsychologists in the country dealing with concussion. His name is Dr. Dan Sherrick. He is in most of our offices across our region, so that means he travels a lot, because we take care of about 9,000 high school students and a couple colleges, and so he needs to be everywhere. But what he has taught me about concussion is a few things. A, we should treat it like an injury, not just some nebulous, it's different. B, it's not just bell ringing, right? When we were growing up and we would get hit in a sport, we would say, you got your bell rung, go back out and play, shake it off, go out and play. Well, your brain's in an energy crisis, and going out and play is the exact wrong thing. So what has happened now is, and you should have Dr. Cherrick back to talk about concussion, it's amazing, but there are 5 types of concussion. It's not just concussion. There are 5 types. So there's one that's preliminarily motor, one that has to do with a inner ear problem, one that has to do with a visual problem, and 2 more kinds that must be diagnosed very specifically. You can't just say, concussion. You have to know what kind it is to apply the correct treatment. Now, historically, 3 years ago, when there was a big concussion summit in Pittsburgh, the treatment was put on dark glasses, get in a dark room, turn off the lights, and just sleep it off. That is not how concussion is treated. Concussion today is treated very actively by accurate diagnosis by a trained neuropsychologist, and then active treatment for the kind of concussion it is, whether it's vestibular rehab, whether it's visual rehab, whether it's motor rehab. And you really need to get to a true expert and not just anybody to take care of it. So that's my number one piece of advice to parents is find your neuropsychologist that is specifically trained in concussion. And thankfully, Northside has Dr. Dan Cherick on all of our campuses. So it's a real resource for us for accurate concussion management.
Now, most of your patients high school students who are injured in high school sports or college or active adults, or who do we take care of? What kind of demography are you looking at?
That's
here?
a great question, because I think when people...
But unfortunately, we don't have a lot of time before the next break, but just we have about...
So sports medicine takes care of people of all ages and skill levels, from, the 8-year-old on the ice all the way up to the 103-year-old who participated in the Senior Olympics. So it's every active person of all ages and skill levels, right?
No, we only have a minute, and my producer's giving me the evil eye, but the ages that seem to have the most difficulty would be what, active adults or high school students?
It depends on the kind of injury we're talking about. Each demographic has its own, but the median age of a sports medicine patient, surprisingly, is 46 years old.
Stay tuned. Be right back. Welcome back. We're talking with Dr. Vonda Wright, a board-certified and fellowship-trained orthopedic sports medicine surgeon who serves as the chief of Northside Hospital Sports Medicine. And she specializes in sports medicine for patients of all ages. And in the previous segment, she said the median age of her patients is 47. So, we have a lot of different potential topics, Doctor, but the fastest growing segment of the population is the active adult community, 55 plus, and people are living a lot longer and taking not good care of themselves. And I went to a recent free exam from my insurance company, and I took a test, and they said that my blood pressure was 133/77, and for my age, they said that I was in the best health anybody's seen that all week.
That's fantastic. Yes.
So, but I go to the gym every day.
Yes.
And I go on the elliptical machine for about 20, 30 minutes and do some yoga. And what kind of a general program would you recommend for people? How would you say, 50 to 60 or 60 to 50 to 103, or what would you say?
Well, the nomenclature is we have youth athletes, right? And then smack dab in the center, we have just the athlete. And then we have the master's athlete. And then after you're 80, you're a grandmaster. So I think what you're asking me about is the master's athlete. So I draw the line in the sand at 40 for master's athletes. The NIH, for research purposes, draws it at 35. But it just means that people are mobile. Either they're not professional athletes, they're just mobile for health or mobility. So when you look around a sports medicine waiting room, the median age is 46. But there really are those other clear divisions. So each one has different needs. Now, what you're talking about is why in the world wouldn't you want to feel amazing like you do every day? Why wouldn't everybody want to be what you're talking about, which is the healthiest person in their 70s they've seen all week? Well, I think that until we really feel bad, sometimes it is hard to pay attention to that, right? We're all busy people. Sometimes it's really hard to pay attention to our future health when we're doing okay today, right? But so what I've started addressing with people is how to live more every single day. How is the decisions I'm making today going to make you feel today? Because I find I can't get people to plan for 20 years. So when you say to me, why wouldn't somebody take care of themselves? Why would they allow themselves to sit around? And, well, I don't know, because it feels good to eat the Big Mac today. It feels good right this minute. It satisfies something we need now because no one's thinking about what it's going to do to them in 20 years. So the way I ask people to think about their health or to develop a plan for healthy living is I've boiled down to 5 simple things because it's hard. It's not rocket science, and yet there's the whole industry has risen up around health. So number 1 is no toxic chemicals in our body, whether it's smoking. Thank God Richard Carmona, the 17th Surgeon General of this country, banned indoor smoking. But now we've got vaping, and we've got a lot of previously illegal things now legal. So no toxic chemicals in our body. Number 2, sleep and restoration is vital for mental health. It's vital for our cells to clean out all the toxins they've made all day. And it's actually great for health because 12 hours of fasting is known to regenerate intracellular metabolism, and a Nobel Prize was won for that. So all those things you accomplish by sleeping, right? So no toxins, good sleep, big social groups, having a lot of friends, being connected with people is so much more healthy than being isolated. Smart nutrition, which we can talk about, or there's lots of topics, but the number 1 thing I ask people to do if they want to start simple is cut out added sugar and simple carbs. And I've done this myself multiple times because I fall off the wagon. But when I do it, I always lose weight because Americans eat 16 pounds of sugar a month and don't even know it. And I feel amazing because I'm an old athlete and I hurt every day of my life if I eat sugar. But when I'm off, I am not inflamed. Nothing hurts. And so that is one thing people can do diet-wise is cut out the sugar. And then is that 5? We talked about social, sleep. We talked about smart nutrition, mobility, and no toxins, right? That's 5.
What about alcohol?
What about alcohol? What alcohol are you talking about?
Any kind of alcoholic beverage.
Well, so if we're talking about calories are calories, whether you get it from a Big Mac or a frothy cocktail. So there's that. There's the sugar in alcohol. Some studies, it goes back and forth, unfortunately. Some studies say that men can tolerate 2 glasses of red wine a night and it's good for your health, and that women can tolerate 1. The way I like to talk about alcohol is that Pinot Noir wine contains in the grape skins a substance called resveratrol, which is a great for anti-aging. It's an anti-inflammatory, antioxidant. Unfortunately, we can't drink enough red wine safely to get what we need. So there are resveratrol capsules out there. But I think when it comes to alcohol, you have to be moderate. If it changes your mental status so much that you then fall down and break a hip, well, that's terrible. If it doesn't, if you're enjoying it socially, it builds your health. So I think everything in moderation.
Different people have a different definition of moderate, though.
I'm sure that's true.
I know some people think 3 or 4 cocktails a night is moderate, but that's not moderate in my definition. I'm sure it's not in yours as well.
Well, I think they must be seeing some consequences of that. So
they do, I'm sure. When we get back, we're going to talk about a few other areas of her practice, and they would be pertinent to different parts of the body, such as knees and elbows and shoulders and hips, and surgery versus other ways of remedy. Stay tuned. We'll be right back.
Great.
Welcome back. We're talking with Dr. Vonda Wright, and her title is Chief of Northside Hospital Sports Medicine, and she's written 5 books and contributed to many professional journal articles and on television and radio, and happy to have her on my show today, and hope we'll have her back again soon because she sure is providing a lot of useful information. And, sports medicine, when I think about that, I think about a lot of things, including hips, and people my age are having these hip replacements and knee replacements and shoulder replacements. And what kind of a macro kind of information could you disseminate about those kinds of
about total joints?
Surgery?
Yeah, so total joints. So Northside Hospital is really fortunate that I have a group of partners who specialize in total joints. There's 8 guys. They're all guys. And they're in all parts of the city, whether it's for our Forsyth campus or Cherokee campus down in Atlanta or Midtown. And they specialize in putting total joints in people. And my philosophy on total joints is that when we wear out the body's natural resources, thank God we have a metal way to rejuvenate you. So historically, we put in joints at the very last minute when you can't walk anymore. But now we know that if we keep people mobile longer, they'll be healthier. So we're putting joints in healthier and younger people as a way to provide them with mobility they might not have had. And so the things you can do to preserve your joints are you'll feel less pain if you don't eat sugar, number 1. Number 2, joints bear 10 times body weight. So if you're carrying 100 extra pounds, your joint is carrying 1,000 extra pounds of pressure. So any little reduction in weight you can do is good for your joints. The stronger your muscles, the better for your joints. So even if you've got a lot of joint pain, there are lots of ways to build muscle, like get in a swimming pool and run in the pool, or use a rowing machine, or use a bike. There's lots of ways that the muscles can keep the joints healthy. And then when you're in pain, there are a lot of non-operative ways that we can use prior to joint replacement, such as injections of synthetic joint fluid or anti-inflammatories. We use not stem cells, but something called PRP. It's platelets that contain all of our growth factors, which have been found to be efficacious in arthritis, and you can have injection of those. But when the time comes when you need to be healed with steel, which is what we call joint replacements, it's a fantastic option. And in fact, my 78-year-old father still runs races with his total hip, and he was in the turkey trot that the Atlanta Track Club did last weekend and ran 12-minute mile pace. So that's fantastic with a metal hip. So it really gives you your life back.
That is amazing. My dad had a knee replacement at, I think he was 87.
Yeah.
And he lived to 97, and the knee that was replaced was better than the other one.
That's right.
He got a lot better on that knee than
really is.
The other. He put it off as long as he could. But what kind of advice would you like to give people now about health and fitness and preventative, so that you will lose patience?
That would be a great day if we put ourselves out of business. I don't see that happening soon. But you know what? I think that health doesn't have to be, and the longevity or how you live every day doesn't have to be a passive and circumstantial process. I think there is so much evidence now that the decisions we make every day can directly affect not only how long we live, but what we feel like every single day. And who wouldn't want to make those decisions that help you feel great? So those 5 things I talked about, the pillars of health: smart nutrition, mobility, social groups, no toxins, sleep and restoration. That's the simplest way to start. And so if I am telling a beginner who just has health that they're so disgusted with, number 1, get good sleep. Number 2, make sure you find some friends, even if it's going down to one of the local coffee shops and making some friends to hang out and drinking coffee with. But number 3, start your nutrition plan by cutting sugar. Read labels. Figure out how much added sugar is in each product. Your taste buds, after about 7 days, will not remember the sugar. And I'm telling you the truth because I've done this. And I am currently not eating sugar. And it's fine. I'm sitting before you today not eating sugar or simple carbs, and I'm good. And then mobility. Any little bit of mobility will do. And seriously, park the car farther. Walk up the steps. Leave the dishes on the table and take a walk after dinner. It's all going to add to your health.
Thanks for being on the show, Dr. Wright. It's a pleasure to have you, and I hope everybody will take seriously the words of wisdom from Dr. Wright. Thank you for listening. Have a nice day.